Hello, this is Patricia from CVAA. I'm a health insurance counselor and I'd like to walk you through Medicare.gov. So the first thing we're going to do is you're going to want to go to www.medicare.gov and you're going to click on Find Your Health and Drug Plans. The next screen, what you'll see is you have the ability to just do a general search, and we're going to type in our zip code. If for some reason you needed to do a personalized search and figure out what your drug plan is, you could do that below. But for today, we're going to do a general search. The next page talks about information, and I always mark I don't know, because I don't want to filter the information. If for some reason you know that you're getting Medicare or the Medicare Savings Program, feel free to plug that in, and it will affect the costs as you bring up your drug plans. This next screen is going to be where we build our drug plan information. So we're going to type in each medicine, and the first one is going to be Lipitor. So you type it in and you click Find My Drug, and it's going to come up and show you the dosage, the quantity, and how frequent. So this person takes 20 milligrams once a day, which equals 30 pills every month. And they take the generic, so you're going to click in for the generic. That's how simple it is. We're going to add the next medicine. But before we do that, on the right side, I want you to look at, there's a drug list ID saved to the right. So if you needed to bring up your information, you could bring it back by putting in that drug list ID. But we're still building a list, so we're going to put in Lantus, and we're going to pick the Solastar. This is an insulin pen. It comes as an injectable. It comes in a package of 5 pens, and we're going to get 1 package every month. We always leave the pharmacy type as retail. And as you see, it's building your list of medicines below. The next one we're going to put in is Ambien. And we see Ambien on the list, and we click Add. And the person takes 5 milligrams every night, and so you get 30 a month. And we take the generic of zolpidem tartrate. The next medicine that we're going to add is warfarin, sodium. It's a blood thinner. Many people take multiple doses of it. This person happens to take 5 milligrams every other day. So what's important here is to click on 5 milligrams. We're going to put in, you get 15 pills every month, and then add that medicine. And as you build your list, you can go down and you can add another dose of warfarin, as we are now. And then every other day, when they don't take 5 milligrams, they're taking 3. And then we're going to change that to 15 pills each month. You want to build your medicine list to look as closely related to what you do as possible. And the next medicine is going to be Spiriva, which is an inhaler. Sorry about that. And what we'll do is we're going to click on Spiriva. There's no choice. And it's 90 aerosols, and you get it every month. And next we're going to look at metoprolol. Now there's 2 choices, and it's critical that you put in the proper medicine. Some have ER. Many of the medicines might have an XL or ER or CR. That's a controlled release, and you need to put it in just as you take it. Now this person takes 25 milligrams twice a day or 60 a month. And lastly, it's really important, even if you take a medicine once a year, that you make sure that you can get it through your drug plan, like clobetasol, which is a cream. So we're going to say this can come in creams, ointments, lotions, shampoos. This person takes an ointment, and they get a tube of it once a year. We put it on the list to make sure that you can get your medicine. So I have 8 medicines now, and my drug list is complete. Next, we have an opportunity to select which pharmacy do we get our medicines locally. And so I'm going to pick Hannaford. and we can pick up to 2 pharmacies, and we could increase the search value if we need to. And we're going to pick Kinney's. Next, what you're going to see is you're going to get some choices, and you have 26 drug plans available to you now. So we're going to pick, let's look at the drug plans. And it should put them in order of what's the least expensive and best suitable for the medicine list that you have. So we're going to look at the first drug plan. It's called Transamerica Medicare RX Choice. It's talking about what is the cost today, the premium, the deductible, and are all your meds covered, and are there some restrictions? It talks a little bit about the ratings, and you can enroll from this screen, but we're going to look at the plan closer. So I'm doing this in April of 2015, so it's assuming I'm enrolling for May 1st. So there's the name of the plan, the contract number, the plan ID is 035, and then the information. You could also call the plan at the non-member number to enroll, or you could enroll from this screen as well. We're going to scroll down and we can see the drug plan premium, the deductible, the cost based on where you're going to get your medicines. It will give you the 3 costs, and as you can see, you don't save any money by doing mail order with this medicine list. We're going to scroll down and you're going to have tabs for Hannaford, for Kinney's, and for mail order. Okay. And we're going to look at Hannaford today, and it says it's a standard retail cost sharing. Sometimes there's preferred pharmacies or standard. You want to make sure your pharmacy takes your plan. So what we're going to do is we have built a medicine list of almost $1,500. And this is the full cost of the medicines for 1 month. In the initial coverage, there's not a deductible on this plan. But on the initial coverage, when you go to get a medicine, you're going to be paying this copay level, which totals $135. Once you reach a certain level, and it is $2,960 for 2015, you're going to go into that gap of coverage. And then you pay the amount of money in the coverage gap. And once you get through the gap, you'll pay the amount of money in catastrophic coverage. So right here, it's going to show you, if I was to join a plan today, the gray part is saying that my premium is $41 a month. The green part is my copays. Once I hit that level of copay, I'm in the donut hole. The orange is the donut hole. And if I hit the blue, that's the catastrophic level of coverage. Across the top shows the amount of money that's going to be approximately, these are estimates only, coming out of your pocket when you go to the pharmacy. Okay. And down below is important because it's going to show you a couple of things. It's going to tell you, one, are my medicines covered by this plan? And it will tell you if they're Tier 1, Tier 2, Tier 3. And then if you look over to the right, it's going to talk about restrictions. And the first restriction is prior authorization. We'll need to check for zolpidem tartrate. And the next one is the quantity limitations, which there are. If there's anything in blue, you're able to click on it and look at the quantity restrictions. And fortunately, this plan doesn't have any step therapy. So right now we're going to look at, there's this restriction on Spiriva, you get 1. And there's a restriction on zolpidem tartrate, and you can have 1 every night. So these are fine restrictions. You'll be able to get your meds as you take them. So we go back to the plan, and at the bottom we'll show you again your medicine list. If for any reason you need to change your medicines, you forgot one, or you want to change your pharmacy, you just go to the top and it will take you back to that area, and you can just start from that point on and make your adjustment. But if we wanted to go back and look at another plan, we can return by clicking Previous, scroll down, and we could look at the second plan for our medication list. Okay. And you can compare the first 2 plans and the costs, and you can start to look at what decision would be the best for you. If you have further questions, please don't hesitate to call your SHIP counselor, and we'll show you the number in a minute. But I thank you for taking the time today to review Medicare.gov with us. I hope it was helpful.